COVID-19 has had a major impact on all of us, particularly those on the front lines at hospitals and medical facilities. Healthcare organization workflows around the world have been altered to ensure that they deliver the best in patient care while adhering to social distancing safety guidelines.
So we're at the point now where digital pathology has supported cytology. We're kind of in a groove, and it's working well. But I've asked Dr. Monaco, who's the end user, to use these systems and to log into systems, use different passwords to give you her personal experience. So Bruce, I'm going to ask if we could transfer over to Dr. Monaco and she can tell us what it's like to actually work from home now that CLIA has waived the ability to do so.
Hi, I'm Sarah Monaco. So I had the unfortunate experience of being the first pathologist on service during the first week of the COVID pandemic. And I'm sort of a working mom. I have 3 little kids. I have a husband who's also in medicine. And when Monday hit and I realized I wasn't going to be in the office and I was going to be doing it from home, I realized I had 3 kids and a husband doing telemedicine and myself doing telecytology from our house. Some of the advantages for us is that we had really a well-oiled machine. We had already validated telecytology using live video streaming with RMT and with whole slide imaging at Children's Hospital. So that was a big advantage. We also have amazing cytotechs that braved the storm and were wearing PPE in the front lines. So I have to set my hands off to Dr. Pantanowitz and our whole team. The live video streaming worked on my laptop without using remote desktop. But then as Dr. Pantanowitz mentioned, we did some workflow alterations, which did make things a little bit more challenging. So normally I fill out the paperwork with the patient identifiers, the preliminary diagnosis, and I ordered stains from my office, and my secretary then faxes it to the lab. Since I wanted to be HIPAA compliant, we were really not doing paperwork from home. So my techs were completing all of that paperwork and writing down my diagnosis and everything on site. So I was basically hands-free entirely. They did everything for me, which was a blessing.
Because we had embraced digital pathology already. We had validated it. Everyone was trained. And since the pathologist was always remote, and we even made them remote so that they could do telecytology outside a meeting, outside a clinic, in their car, waiting to give a lecture. It really didn't impact us that much to be able to have the pathologist now work from home. We managed it. We were able to continue with the care. We were able to minimize risk to pathologists, which is great. And we deal with the staffing shortages that we had, school closures, people being quarantined, not having too many people in the office at the same time to adhere to social distancing. So I think it was a win for informatics.
And from a training standpoint, our fellows actually were on service with me that week, and so they can actually log into RMT to see the live video streaming separately.
This webinar has been a great tool in supporting telemedicine for remote pathology. RMT advocates were able to provide valuable feedback to colleagues looking to implement telepathology into their new daily workflows.